Hello, I'm Senator Ben Cardin. Welcome to Facebook Live. I do use this forum to go over with people of Maryland and throughout our country issues that are pending in the United States Senate. There's no more important issue right now than the nomination that President Trump made to the Supreme Court of the United States and the confirmation process. I should say there's no other important issue, but I would also add to that how we deal with COVID-19 is the most urgent issue that our country is facing. But today we're going to concentrate on the Supreme Court vacancy. And I have talked frequently on the floor of the United States Senate about my concern on the process that was used. I say that for many reasons, because the rules that apply to Republicans should also apply to Democrats. And it's unconscionable that the rules that the Republicans impose on the Democrats under President Obama, with the vacancy created by Justice Scalia and Merrick Garland's appointment by President Obama. That vacancy occurred in February of an election year. It was the Republicans who announced very boldly that they would not consider a nomination on the Supreme Court in an election year because they felt very strongly the voters should have a say and the person elected to be president should make that appointment. That was a February vacancy in an election year. As you know, Justice Ginsburg died in September. The election process had already started. Republicans said that even if there was a Republican president, they would follow the same rules. They are not following those rules. It's for that reason that many of us think that this is really not an appropriate nomination to the Supreme Court, regardless of the individual that was selected, because the process is not fair. It's being rushed. We're not going to have the normal opportunities for visits and vetting and debate. And right now, the Judiciary Committee has completed its public hearings and expects to vote on the nomination this coming Thursday. We then believe that Judge Barrett's nomination will be on the floor of the United States Senate the week after that, the week before the elections. That's certainly an unprecedented process that the Republicans have used. But on today, I have special guests with me that can talk about why this particular appointment, why a member of the United States Supreme Court in this time, what impact it could have on your everyday lives. The Supreme Court of the United States is scheduled to take up the constitutionality of the Affordable Care Act. That's going to be taken up in November. President Trump said that he would only consider justices that would rule the way he wants them to rule, including repealing the Affordable Care Act. So this is not hypothetical. This is real life circumstances. And today we're going to have an opportunity to sort of put a face on these issues. We hear about the numbers, the statistics of people that are protected by the prohibitions on pre-existing condition exclusions, or the caps, or the provisions we have that can help small businesses. We're now going to have an opportunity to talk to people who are directly impacted by that potential decision. So in November, the Supreme Court will be hearing the Affordable Care Act. As you know, it was a 5-4 decision that upheld its constitutionality originally, but now there's another case before the Supreme Court. And Justice Ginsburg voted on the prevailing side in the last case. Obviously, the person who replaces her on the Supreme Court could be the deciding vote. So for that reason, I'm pleased to welcome Salliann Alborn, who is the CEO of the Maryland Community Health Systems, who knows firsthand the needs of healthcare. She is involved in our qualified health centers, which are critically important to provide help to particularly underserved communities. Dr. Willarda Edwards, she's an internist in Baltimore, past president of the National Medical Association, and U.S. Navy reservist with the rank of commander. We have Barbara Gruber, who is she can tell her personal story. She lives in Baltimore, and she has been impacted by pre-existing conditions. Jamal Lee from Laurel, a small business owner, who can tell us some of the challenges that we have in regards to the small business community. So if I might, I think I'll start with Salliann Alborn. If you could explain a little bit about the Maryland Community Health Systems and Qualified Health Centers and how the Affordable Care Act impacts your ability to serve your constituencies.
Senator Cardin, thank you so much, and it's a privilege to be with you this afternoon, and for the others that have joined us as well. You know, my story in working with the federally qualified health centers is really Maryland's story, because today we have a historic low of 6% of Maryland's population uninsured. Prior to the Affordable Care Act, that number was ranged between 10 and 16%, depending on the geographic area of the state. An unconscionable number in a country with the resources that we have. And how that translates into everyday life is that in 2013, only about 21% of people, of our citizens, saw a primary care physician. In 2018, that number had been reduced to 16%. For the people who were not getting care, 7% of our population in 2011 were not able to access care. And today, that percentage is down to about 2%. And for our federally qualified health centers, as you know, there are 17 federally qualified health centers located throughout the state of Maryland, on the Eastern Shore, in Western Maryland, and in our metropolitan communities. And for the last 45 years, we have been serving all comers. Anyone who comes to our door, we provide them with a comprehensive array of primary health care services. And prior to the Affordable Care Act, many of those people were uninsured or underinsured, but we provided them care anyway. In some cases, some of our health centers had 50% of their population uninsured. And that range was from about 20% up to about 50%, again, depending on the geographic location. And as I said, the overall state population of uninsured people is down to 6%. Still means we've got to get the rest of that 6% covered. Let's not forget that. But it means that people can come to us now, and we would have provided them care anyway. But had they needed to have the services of a cardiologist or a neurologist or surgery, we would not have had anywhere to refer them to, because they would have had no mechanism for having that coverage care, that service provided. Now, with the Affordable Care Act, and because they're either covered now by Medicaid, our fabulous Medicaid expansion, and the incredible job of the Maryland Health Benefit Exchange, which is now covering more than 153,000 people, and Medicaid about 1.2 million people in our state. We're able to make those referrals and see to it that people get the care they need. So for us, this has been an amazing story about providing a fundamental benefit, a privilege to the citizens of Maryland.
So let's be clear. The case in November is aimed at setting aside the entire Affordable Care Act and all the provisions that were included in it. Part of those provisions provided direct support for qualified health centers.
Yes.
As a result of that additional support, qualified health centers expanded their benefits and their coverage areas, including, in many cases, additional services for mental health, for dental, for addiction, that was not provided before. That is in jeopardy if the Affordable Care Act is held to be unconstitutional. And as Salliann, as you point out, the Affordable Care Act established what's known as essential health benefits, so that all healthcare plans must cover these essential health services. So if you had health insurance before, it is very possible it didn't cover all the services that you're talking about, and there still could have been gaps.
Yes.
You mentioned the numbers, and those numbers are important. Nationwide, 11.4 million Americans have signed up under the healthcare exchanges. In Maryland, as you pointed out, it's over 150,000 people whose direct coverage is in jeopardy. But we also expanded Medicaid. Maryland took advantage of the expansion of Medicaid. 12 million additional Americans were added to the Medicaid rolls, 310,000 in Maryland, giving insurance coverage. So what did this mean for an internist working in the Baltimore area who is committed to serving her community? Dr. Edwards, share with us what the Affordable Care Act has meant in your ability to provide care to the people in your community.
Thank you, Senator Cardin. I really appreciate this opportunity. As you mentioned, I'm a primary care private practicing internal medicine physician in Baltimore, with my patients mostly living in the Southeast Baltimore or Dundalk area. And I see patients with heart disease, diabetes, common cold, and lung diseases such as bronchitis and asthma. My patients largely are covered by Care First, TRICARE, Medicare, and the Medicaid that you talked about. And for those that are not eligible for these insurance, they were able to then purchase their insurance via the Affordable Care Act. So it was truly for them a godsend. The ACA affords my patients the ability to extend their coverage to their kids up to age 26 years of age. Also, there's no lifetime limit on coverage. They're able to then get preventive services like mammograms and have coverage for their medications. And the majority of my patients have pre-existing conditions such as diabetes, high blood pressure, heart disease, or lung disease. Therefore, if it weren't for the ACA and the fact that pre-existing conditions are not allowed to prevent them from having reasonably priced health insurance, they would be among the many who have no health insurance at all. So because of their coverage, they're able to be seen regularly to get their blood sugars, their cholesterol, their blood pressures checked and always under control. This has long-term effects that could mean less hospitalizations, heart attacks, or strokes for my patients and for our community which I serve. So the ACA also covers, as we've been talking about, patients that will encourage them to get preventive measures, take preventive measures, such as making sure they have eye exams, which is really important when you have high blood pressure or wear glasses or have a family history of diabetes or glaucoma. Then also your GYN exams and mammograms are covered. Colonoscopy is important for people to have in order to prevent the incidence of colon cancer, colon rectal cancer. Prostate exams are available for a gentleman to make sure that they don't have prostate cancer. And then most importantly, especially in the time that we're in right now, immunizations. Having that coverage for flu shots or for the pneumonia vaccine or the shingles, HPV, or hepatitis. That's so important. And we want to make sure that in this time of COVID, the people are continuing to get those services so that we can prevent all of those unnecessary incidents of disease. And so given the current pandemic, many of my patients have lost their jobs, unfortunately, that were jobs that were associated with health insurance coverage. And so for that reason, many of them may or will need or do need to get coverage via the ACA. And so without the ACA, if the COVID is added as a pre-existing condition, the cost of their insurance may well again be much too expensive. So universal coverage is going to be more needed in the coming days of post-COVID. And in the meantime, we need to keep in place the components of the current ACA law and build upon that, not get rid of it, but build upon it in order to keep our communities better served and having better universal access. So we need universal health insurance coverage for everyone, and ACA is our ground upon which we can build that.
Dr. Edwards, you point out the protections that were not in the law prior to the ACA. There was no protection on pre-existing conditions. And the Department of Health and Human Services tell us there could be as many as 133 million Americans that would be have restrictive coverage if the protections under the Affordable Care Act are stricken down by the Supreme Court as a result of November hearings. That could very well include 8 million Americans who have been diagnosed with COVID-19. That could very well be a restriction without federal protection on pre-existing conditions. A woman who's given birth to a baby could very well be a pre-existing condition. This is not hypothetical. There were restrictions in the law prior to the Affordable Care Act that discriminated against women. And the list goes on and on and on as to how many people may be denied full coverage for a condition that they have, or their gender, or the fact that we are living through a pandemic. And we could go over those numbers. I did go over some of the numbers, but it's so important to understand that this is not hypothetical. People had to live with this fear before we had the Affordable Care Act. It was common to see families have to go through personal bankruptcy as a result of the not having adequate coverage to cover their medical expenses. We thought we were past those days, but now it's a real fear today. So I particularly want to thank Barbara Gruber for being on this chat so we can hear your personal experiences that you had to go through with our healthcare system and how the Affordable Care Act has made those problems much, much less real. Barbara.
Hi, thank you. Thank you for allowing me to tell my story. I'm 62 years old. I was born with asthma. I have coronary artery disease, broken bones, and autoimmune disorders. I rely on medication to stay alive. I have worked my entire adult life except when I was sick or when I was going to school. When I was a kid, my father's insurance covered us. When I was married, my husband's insurance covered us. And then I was a single mother, and it was just me and my son. I had many, many different jobs, and the benefits determined our healthcare, the benefits that the jobs offered. Sometimes companies offered health insurance and they covered my son. More often, I was a temp or I was hired for just under the number of hours to qualify. Plans for single parents on the individual market were so much more expensive than anything that a company offered, and they didn't cover anything. They would be outrageous deductibles, or they didn't cover pre-existing conditions, or they covered pre-existing conditions, but they were defined so broadly that they didn't cover anything at all. And it was just very difficult. For 20 years, I've been adjunct faculty at a lot of different colleges and universities. They limit the number of courses adjuncts teach so they don't become liable for insurance, and they don't pay a lot of money. Even so, it's been the best job I've ever had. I was able at some point to get insurance through the university, but it became too expensive. So these are some of the things that I've done to get and keep health insurance. While teaching 5 classes a semester, unable to buy individual insurance that would cover me, my friend hired me at minimum wage so his company could insure me. I worked there for 5 years in addition to teaching those courses. One doctor would give me sample inhalers and medications that he got from pharmacies and pharmaceutical reps if I paid cash for them. One doctor, I bought catastrophic plans that only covered accidents or hospitalization under specific circumstances, and then only after you paid ridiculously high deductibles. It just, when I was able to buy insurance through the first university, that was just in time to cover my first heart stent. It was expensive. It didn't cover everything. Premiums rose every year, and they exceeded 30% of my income. Not healthcare costs, not just healthcare costs, but premiums. And it was expensive. I didn't have the money to pay for health insurance. I had got another stent. I got coronary bypass surgery, and I couldn't afford it. I was going to go bankrupt until my sister offered me her share of our family house, which also makes me lucky. There was a family house. When the ACA became law, for the first time ever, healthcare costs were not over 50% of my income. There was an affordable individual plan that offered everything the corporate plans did. Corporations and insurance companies will not willingly offer benefits, and few people, fewer every year, work for those who do. The ACA fills this gap. As late as 2019, my insurance company refused to pay for covered medication and treatment until the Attorney General's office intervened. Then they paid. If pre-existing conditions are no longer covered, I and millions of others will lose not only our health insurance, but our health. I am so glad to live in Maryland, where we support the ACA, and I don't know where I would be today if not for it. It's just enabled me to stay alive. Oh, and I remarried in January, and my husband has insurance, so I'm covered by his insurance. So thank you for letting me tell my story.
Barbara, thanks for sharing that. I'm going to ask you to put yourself on mute right now. Thank you. Thanks for sharing that. I really appreciate it very much. It's so important that we recognize that when we talk about the over 100 million people that could be impacted just by the pre-existing conditions alone, that each one has a story. Each one would be at great risk of going into bankruptcy or not getting the health care that they need. And it's more than just pre-existing conditions. There are caps. If you have a serious medical issue under the pre-ACA insurance plans, you would reach your annual and maximum caps pretty quickly. And so many people could not get the type of treatment they needed to deal with cancer or to deal with serious issues that it was denying people reasonable health care. And then lastly, as you point out, the cost of healthcare before the ACA was going up at an astronomical percentage every year. And if you didn't have an employer who provided comprehensive plans for you, you worked for a small company or your employer just could not afford that type of policy, there was no requirement for that, you were on your own. And in many cases, you could not afford adequate coverage at a reasonable rate. But small companies were particularly at risk because they didn't have the same numbers, and therefore the insurance companies wanted to charge those small businesses much more for the same coverage that a large company could pay. And a small company has a difficult time enough to compete with larger companies. If they have to pay much more for their insurance, it's just not available. The Affordable Care Act did two things to help small companies. It provided larger pools so they could get into a more comprehensive plan. It prevented discrimination against them and provided certain tax incentives to allow small companies to establish plans for their employees. I'm so pleased that Jamal Lee is with us. He is a small business owner located in Laurel, Maryland. And I know that he has dealt with this issue both before ACA and now under ACA. So Jamal, thank you for being with us to share your circumstances.
No, thank you, Senator Cardin. I'm glad to be here. It's an important time right now. We've gone through such a difficult challenge as small business owners. And I work with several constituents in that space. And, you know, I sit on a few different boards and we work heavily to make sure that we have, you know, a level of equality across the board. As a small, I own Breager Productions, a small business in Lower Maryland, as you said. We do lighting, sound, video, webcasts, and streaming. We got good people, great people working for us. Great people that deserve an opportunity to have healthcare and to have it affordably. And you know, I'll tell you, my wife and I, we went through a very difficult challenge. I'll just tell my quick story, and I'll be right out of your way. We went through a difficult challenge a few years ago, more like I guess like seven years ago. I came home and she was lying on the floor and she was dying. Literally, she called me and she couldn't speak. So I rushed home, my daughter and I, and she was on the floor dying. And we were able to get her up and get her to the hospital and not have to think about where we could take her because of insurance. So we were able to take her, and the doctor told us that if we didn't get her there when we did, she would have died. So, and since then, I've had a beautiful son. He's 4 years old, Charles Alonso, because of her, and she's pregnant now, actually. So I'm grateful for that. But in regards to my company, though, the insurance costs were so inflated pre-President Obama that we couldn't afford to offer these opportunities to our employees. Because of the ACA, those rates came down to an affordable area, space that we could operate effectively and grow. Every dollar saved is a dollar earned. In addition to that, we had tax credits. We have tax credits that have allowed us to save money in that space, and we use that as a means to continue to grow and develop our organization. It was challenging. It's challenging, period, for any small business, especially now in the COVID state. We have a production company. As you all know, production stopped. So there's no way we could continue to grow and develop without having every opportunity available to us. Healthcare reform works for me. The subsidies and the tax credits, they work for me because of the lower costs and the health coverage. My bottom line is better, and that works for me. Any dollar that we save, we are able to use that to create and grow. You don't have to be a genius to understand that these principles. My premiums went down, and it allowed me to bring on workers, bring on new equipment, grow and develop, create a superior product right here in the U.S. We do national events, and they look and sound great. The subsidies and grants literally gave me money because from the business mind, or the mind of a business person, is when I'm not spending it, I'm using it to develop our organization. I have a small business that that allows us to send out a product that affects millions of Americans. The best decision I could make was to make sure that I supported in this business. One of the best decisions I could have ever made is to make sure that we support the ACA. I think it's very important that we come together as just as you are, and I appreciate your zeal and your fire for this very important issue, because it's allowed us at least a voice that could explain to others that are against such an important movement that we need it. And it's important also that those who are in position that are fighting against this, the American people have already spoken. We already said what we want. And it's no reason to go against what the American people across the board has already said. It's almost disheartening to a degree to think that people at the highest level are really not thinking about us, and that's difficult for me. So it works for me, and we will continue to fight diligently and hard to make sure that we keep these things in place. It is imperative that we do not allow the forward progress that we've had to be diminished, or to send us back to what we think America. Well, I don't know what America was great without the ACA. So it's very important that we keep that going and stand strong in this place. It's imperative. It's very important. Yeah, I'll leave it there.
Jamal, thanks for sharing that. I take special interest in the challenges of small businesses. I'm the ranking Democrat on the Small Business and Entrepreneurship Committee. Prior to the ACA, if we had a roundtable discussion among small business owners, the availability and price of healthcare coverage would always be one of their top 2 or 3 issues that they would mention. Always. They couldn't get affordable plans. They couldn't get plans that really covered all of their employees. And if one of their employees got sick and made a major claim, the next year the premium for that company would jump by an astronomical amount. So it was so difficult, particularly for the smaller of the small businesses, to provide health benefits for their employees. Now, that puts small businesses at a tremendous disadvantage when you're trying to get a workforce, people to work for you, and you can't offer them health care. And your competitor, which is a larger company, can get affordable health care, and you can, as a small business owner, you're jeopardizing the health of small businesses. And when you jeopardize the health of small businesses, you're jeopardizing our economy. More jobs are created by small companies. Innovation occurs in small companies. So this was really one of the great hurdles we had in our country. And it seems to me people might have short memories, but I can tell you this: the Affordable Care Act is critically important for our economy, in addition to the health care of the people of our country. It also has brought down the curve of healthcare costs rising because we have more people in the system. When you have people who don't have health insurance, they cost you more money in the system, and it's less efficient healthcare. They don't get the preventive care that they need, and it ends up costing more dollars. So I want to get back to Salliann and Dr. Edwards for one moment and talk about the importance of the expansion of Medicaid. I don't know if everyone knows what the typical person on Medicaid, their circumstances. Many are workers. Our seniors benefit from Medicaid. And we've had a tremendous expansion of those covered by Medicaid as a result of the Affordable Care Act. And if we lose that expansion, the states do not have the resources to make this up. They're already hurting from COVID-19. So we're going to see a large number of people who have Medicaid coverage are going to become uninsured. So from the point of view of providing adequate care to people, but also to have an efficient healthcare system that can operate in the community, what is at risk if, in fact, we find that in Maryland, all of a sudden, 310,000 Marylanders who are covered under the expansion of Medicaid, were to lose their benefits as a result of the ACA being held to be unconstitutional? I'll start with Salliann, then we'll go to Dr. Edwards.
Well, as far as I'm concerned, Senator, this would put us back into the dark ages of healthcare because those 300,000 people would have no place to go. So they would either go without care, and that would imperil their health and their well-being and that of their family. And as Jamal said, perhaps even devastate them in terms of, their own personal finances, their home, lose their home or whatever. They would have to resort to going to emergency departments to get care, where emergency departments don't do preventive services, and they don't provide long-term care for chronic diseases and things like that. All they can do is take care of the immediate situation. So the person goes and gets their pain or their discomfort or their symptoms taken care of during the emergency room visit, but then they go back home and there's no place else to go. And even if they come to a federally qualified health center, as I said, we see everyone who comes to our door, but we also have to pay our doctors and other kinds of things. So, there's a limit to what we can do. We see people, but only up to our, what our resources will allow. And so the expansion to Medicaid has, as you said, allowed us to hire additional providers, allowed us to add additional services to take care, OB services, dental services, to expand the number of sites we have, to expand our existing sites so we can see more people. But taking it back to the individual, it just will put people back to the desperate times when they didn't know, couldn't get care, didn't know where to go, didn't know how to navigate the system, and just had their health deteriorate. And that's something none of us want to see. It has really, I'm a nurse by training. I've been a provider, a nurse practitioner and a provider. And, I know what it's like. I've taken care of uninsured people. And I know what it's like to be able to not be able to refer them to a specialist that they need, or not to be able to know that I could give them a prescription, but they can't get it filled. And we don't want to go back to that. It's imperative that we not go back to that.
Yeah, thank you. Dr. Edwards, you represent one of a strong community in Baltimore, Southeast Baltimore, a proud community. You have a community that a large number of the people depend upon the Medicaid system and the Medicare system. So how important is it that we do not return to the days of the uninsured? I know you well enough to know that you treated people who didn't always pay their bills, but there comes a point where you need to have enough people that are insured for health facilities to be located in your community. Otherwise, they just don't locate there, and you run into a healthcare desert where the people can't get the necessary care that they need. So how important is it to your community that we maintain individuals insured?
Absolutely. I'm in total agreement with what has been already said with respect to we do not want to go back to the dark ages. The dark ages being when people did not have good coverage. There was night and day with I've always, from the time that I started my practice 36 years ago, after leaving the Navy, I've always accepted patients that had Medicaid as their insurance. But it was always very difficult to be able to be sure that when I saw that patient and they needed to see a specialist, to then be able to refer them to someone that was a specialist, whether it was a surgeon or a specialist in cardiology or pulmonary, whatever the specialty might be or the need might be. It was very difficult for me to be sure that when I referred them to someone, that person, that doctor also took medical assistance. And so not having the availability of what we have with the ACA, because when we got the expansion, we were able to then make sure that the payments for Medicaid were on the same level as Medicare, and most doctors, regardless of what the other insurances they may take, will usually also take Medicare patients. And when it became on the same level as opposed to 10 cents on the dollar, but more like on the 60 cents on the dollar, which is what Medicare has usually been, then people opened their practices and it was a lot less difficult to make the appropriate referrals. The fact that when people are able to access care because of the fact that they have coverage and they know that they have coverage wherever they might go, then people will go and get the care that they need as opposed to waiting until they're really, really sick and then have to really be essentially put into the hospital. And we know that the cost for care in a hospital or emergency room, for example, is 10 times more than what it is for me in my office. To see me in my office and do all the preventive care can prevent patients from having a bill as soon as they walk into the emergency room. That's like $1,000. You walk into my office, it might be $40 for that visit. That's a big difference. And so having that kind of relief for everyone that had access to the expansion and having Medicaid as their coverage, it just made access so much better for everyone. And then that prevents also when people are getting their preventive care, as I mentioned before, then we have control of their cholesterol, their blood pressure. The less likely they are to then have a stroke or have a heart attack and then incur another hospitalization. They have control of their sugars. They're less likely to have any diabetic comas. And so it's really important that we keep maintain ACA, provide for universal access for everyone. And so what we need to do right now is not get rid of ACA, but definitely build upon what we already have in terms of a great foundation.
Well, Dr. Edwards, I agree with you completely, and that's what we really need to do. There's certain things we can do to strengthen the system. We don't want to weaken the system. But you mentioned, I think, a very important point. I remember the debate during the Affordable Care Act, and we looked at the numbers. And I think we were surprised initially to learn that a person who does not have health insurance will cost you more in the healthcare system for a similar type of medical intervention as someone who has insurance. And you really put your finger on it, because people who have insurance get the annual physicals, they get the checkups, they will almost certainly discover their healthcare needs at an earlier stage, less expensive. They'll use less expensive options to take care of their needs. They won't rush to the emergency room, which is the most expensive way. And we really have reduced the unnecessary visits to the emergency room dramatically as a result of the Affordable Care Act. So it really is a matter of using our resources more efficiently. But Barbara Gruber, I want to come back to you for a moment. I'm pleased to know that you have insurance through your husband. I just remind you that if the Affordable Care Act were to be held unconstitutional, it's very possible that that coverage may not cover all your needs. It may have caps. It may have certain doctors. They won't let you get that type of service. It might not include some of the illnesses that you have right now. They could have pre-existing condition restrictions. So it's no guarantee without the protection of the Affordable Care Act that any employer plan would cover your needs. But you said something that really should alarm everyone, and that is, prior to the Affordable Care Act, it was costing you half of your income in order to be able to take care of your healthcare needs. Did I hear you correctly on that?
Yes, you did.
That's just not right. In America, you should not have to spend 50. People can't afford. You don't have that type of resources to put $1 out of every $2 that you have at your disposal into healthcare. Our economy is now spending 15, 16% of our economy on healthcare, but a large part of those costs are made up through the subsidies we give through government, or through the subsidies we give through employment, or the tax advantages we give. But for an individual to have to incur that type of expense in order to get healthcare needs met should have no place in America. So I really appreciate you bringing that up. It looks like right now you're in pretty good stead. What plans are you making in regards to, I guess you can't plan as to what's going to happen in the Supreme Court, but what would happen if those protections were gone today? Do you have a nest egg of a couple $100,000 to take care of your healthcare needs?
I can't remember exactly where I put it, but I'll go get it in another room, like in another house, somebody else's house. No, we are. No, who has that kind of money?
No. And I said that somewhat sarcastically.
Oh.
Look, nobody can plan as to what's going to happen. We all wish you well, and we're going to fight to make sure we do exactly what Dr. Edwards was suggesting, and that is build on the Affordable Care Act. We should take care of those people who don't have connections with their employment, and their incomes are at that level where they really don't get much of a subsidy, and their cost of healthcare today is too expensive. We got to figure out a way to bring those costs down. We can do it by additional subsidies, and that's what we need to do. We can also do it by more competition, developing a public option within the Affordable Care Act so that there's always available in your community a plan that will cover your essential benefits and is going to be competitive in price. That's what I think we can do in order to improve the Affordable Care Act. Jamal, talking about small companies, do you have any suggestions as to what we could do to make it easier for small businesses to deal with the healthcare needs of their employees?
Yeah, great question. First, I'll piggyback on Salliann and Dr. Edwards. I'll just tell you that, going backwards would be catastrophic, especially for the small businesses. We see ourselves as a backbone of this economy. And by affecting that, that shakes the very structure of our economy. That's my view, small business owner.
Mm-hmm.
I'll tell you, Dr. Edwards was saying, about seeing a specialist. Whenever I needed to see, I give you, just take it back a little bit. Whenever I needed to see a specialist because the cost was so expensive in the United States, I would literally leave the country and go to a neighboring country to get certain procedures done. And I would literally pay less for the plane trip, the airfare, the hotel room, a little shopping, rent a car with my wife, and still get the root canal done for about $1,000, as opposed to the $5,000 or $6,000 it would be here at home. I found that to be disturbing. So I don't know. I jumped on right away, and I took that to my community. I jumped in, sitting on the small business majority, sitting on healthcare for all with Vinnie DeMarco, as well as the working with the U.S. Black Chamber here, which we're doing their event in the room next door, by the way. That's being broadcast all over. It's literally right next door, I promise you. And these are the things that are challenging to us as Americans, and as Black Americans too. I mean, we're really concerned. If we go backwards, it's really how straight up can I be about it? It will be killing us, because we won't have the opportunity to have health care in an affordable state that reaches all Americans. It would be catastrophic. So yeah.
So let me just underscore that point. There is no question that we have systemic discrimination in healthcare in America.
Sure.
The Affordable Care Act took a giant step forward in addressing that type of discrimination. I was proud to have authored the provisions of the Affordable Care Act that established the National Center for Minority Health and Health Disparities. We provided additional resources to make sure that our clinical trials were provided in a fairer way with the demographics of our nation. So we did take steps in expansion of Medicaid. Those who are eligible for Medicaid are going to have a higher percentage of the traditionally underserved communities. Additional support for qualified health centers. Again, they're the communities that have been the hardest hit. But we need to do more. And that's why Senator Menendez and I have been working on provisions to address the facts that when you look at who has been adversely impacted the worst as a result of COVID-19 in healthcare, you see communities of color are the ones that have been hit the hardest. And we think we need to do something about that in the COVID relief package to make sure that we address these types of problems. But I come back to what you just said, Jamal, and what Dr. Edwards said, and I think also Salliann said, we need to build on the current system. We don't want to move in the wrong direction. We want to add to the protections we have, and we want to deal with the problems that currently exist. We've been talking about the practical impact of a Supreme Court decision on the constitutionality of the Affordable Care Act. This is not hypothetical. The Supreme Court has scheduled a hearing on the case of California versus Texas next month. And that deals with the constitutionality of the entire Affordable Care Act. Protections on pre-existing conditions, caps, covering children on your policy to age 26, essential health benefits, and the list goes on and on and on. And there is no question that the filling of this Supreme Court vacancy at this moment could very well affect the outcome of that case. But that's not just one area that could be impacted by this next justice. We could talk about a woman's healthcare decisions and her right to make those healthcare decisions and not government dictating how those decisions will be made. We can talk about the protection of voting rights in America. We know the Shelby County decision, and we knew we took a step in the wrong direction. Supreme Court could very well impact our ability to exercise that most fundamental right. There's clear division in this court on protecting workers, protecting our environment, protecting customers and consumers versus large companies. We could talk about that balance, and the Supreme Court will have an impact on that moving forward, our environment, worker safety, and consumer protection. Or we could even talk about the validity of the November 3rd election. These are not hypothetical issues that may be determined by this Supreme Court, and the filling of Justice Ginsburg's seat at this stage could very well affect any one or all of those issues. So today we've been talking about the impact on the Affordable Care Act because this is one that is clearly current, it's scheduled for hearing, and it will have an impact on every American, every person in this country. I really want to thank our guests for participating in this discussion. I thought the discussion, again, you really put a face on the issues that Americans face, whether you are providing health care as a healthcare provider, whether you're a small business owner, or whether you're just a person who's trying to get adequate protection to protect yourself. So let me thank Salliann Alborn, the CEO of the Maryland Community Health Center, Dr. Willarda Edwards, who's an internist in Baltimore, in Southeast Baltimore, Barbara Gruber, a person who was impacted by pre-existing conditions and was protected under the Affordable Care Act, Jamal Lee, a small business owner from Laurel, Maryland. Thank you all for joining me today, and we'll continue to have these discussions on Facebook Live. Everybody, please stay safe. And again, thank you for allowing me to represent you in the United States Senate.
Thank you.